Congratulations, new mom! Stepping into motherhood is a beautiful and transformative experience. Breastfeeding adds a special bonding layer to this journey. You are not alone. Millions of mothers have walked this road. It takes time, patience, and practice to master. Embrace this journey with open arms and an open heart. Breastfeeding is the golden standard of infant nutrition. Breast milk is nature's perfect food, packed with essential nutrients. Beyond nutrition, it's a bonding experience. The skin-to-skin contact releases oxytocin, strengthening their bond. Breastfeeding also offers health benefits for the mother. Breastfeeding offers incredible benefits, but it's not always easy. Many mothers face challenges, and you're not alone. These challenges don't define your success as a mother. Factors like baby's latch and milk supply can be tricky. It's easy to feel overwhelmed, but help is available. Online communities and professionals are here to support you. Knowledge is power. Understanding common breastfeeding challenges and solutions can make all the difference. This guide empowers you with strategies to navigate breastfeeding confidently. We'll provide practical tips and expert advice to overcome obstacles. From proper latch to boosting milk supply and managing engorgement, we cover it all. Techniques for milk letdown, keeping baby awake, and maintaining a positive relationship. Find what works best for you and your baby. Embrace the journey with patience and humor. Let's talk about sore nipples, a common and often unexpected challenge that many breastfeeding mothers face. It's important to remember that while some nipple tenderness is normal, especially in the early days of breastfeeding, persistent or intense pain should never be ignored. Think of it this way: your nipples are delicate tissues adjusting to a new sensation, and like any part of your body, they need time to adapt. The good news is that with the right knowledge and techniques, you can effectively address sore nipples and continue your breastfeeding journey with greater comfort and confidence. Imagine those first few moments of your baby latching onto your breast, a moment filled with anticipation and joy. It's natural for those first latches to feel a bit different, even slightly uncomfortable, as your body and your baby learn to synchronize this new dance. However, if the discomfort lingers beyond the initial latch or intensifies into pain, it's a sign that something might need adjustment. One of the primary causes of sore nipples is an improper latch. A correct latch covers a large portion of the areola, not just the nipple. This ensures efficient milk transfer and reduces nipple strain. A shallow latch can lead to soreness and cracking. A good latch is key to a comfortable experience for both mom and baby. Experiment with different positions to find what works best for you and your baby. Now that we've explored the importance of a proper latch and positioning, let's delve into some soothing strategies to alleviate nipple soreness. Just like you would tend to any other sensitive area of your body, your nipples deserve gentle care and attention, especially during the breastfeeding journey. One of the most effective ways to soothe sore nipples is to apply your own breast milk to the affected area after each feeding. Breast milk possesses natural healing properties, acting as a gentle antiseptic and moisturizer. Think of it as nature's own balm, readily available and perfectly tailored to your baby's needs. In addition to breast milk, consider using a nipple cream specifically designed for breastfeeding mothers. Look for creams containing lanolin, a natural emollient derived from sheep's wool, known for its moisturizing and protective properties. Lanolin forms a breathable barrier over the skin, locking in moisture and promoting healing. Section 4. The power of prevention. Techniques to minimize nipple soreness. While soothing sore nipples is essential, preventing them in the first place can make your breastfeeding experience even more enjoyable. Just like you take proactive steps to care for your overall health, incorporating preventative measures for nipple care can go a long way in ensuring a comfortable breastfeeding journey. One simple yet effective technique is to air dry your nipples after each feeding. Breast milk, while incredibly beneficial, can sometimes linger on the skin, creating a moist environment that might increase the risk of irritation. Allowing your nipples to air dry for a few minutes after each feeding session can help keep the area dry and promote healing. Another essential aspect of prevention is ensuring proper bra support. Choose bras made from breathable materials such as cotton, which allow for better air circulation and moisture wicking. Avoid tight-fitting bras or those with underwires, as they can constrict milk ducts and potentially lead to discomfort. Section 5. Seeking expert guidance. When to consult a lactation consultant. While the tips and strategies we've discussed can be incredibly helpful in addressing sore nipples, it's important to remember that you don't have to navigate this journey alone. Lactation consultants are highly trained professionals specializing in breastfeeding support, and they can provide personalized guidance and reassurance every step of the way. If you're experiencing persistent nipple pain, despite trying various remedies, or if you notice signs of infection, such as redness, swelling, warmth, or discharge, it's crucial to seek professional help. A lactation consultant can assess your baby's latch, evaluate your breastfeeding technique, and provide tailored solutions to address the root cause of the soreness. Lactation consultants are equipped with a wealth of knowledge and practical tips to help you overcome breastfeeding challenges and achieve your feeding goals. They can guide you on everything from latch improvement and positioning techniques to milk supply concerns and nipple care, empowering you to breastfeed with confidence and comfort. Section 1. Addressing low milk supply concerns, a common worry for breastfeeding moms. Let's talk about a topic that often weighs heavily on the minds of breastfeeding mothers: low milk supply. It's a common concern, often accompanied by feelings of anxiety, self-doubt, and a sense of not being enough. But here's the reassuring truth. Many perceived low milk supply issues can be addressed with the right knowledge, support, and a sprinkle of self-compassion. Remember, your body is an incredible creation, designed to nourish and sustain your little one. Just as nature provides for the ebb and flow of the tides, your milk supply is influenced by various factors, and understanding these factors is the first step in addressing any concerns. Imagine a garden, where the growth of plants depends on factors like sunlight, water, and nutrient-rich soil. Similarly, your milk supply thrives when certain conditions are met. These include frequent and effective milk removal, a balanced and nourishing diet, adequate hydration, and a healthy dose of rest and relaxation. Section 2. Understanding the demand-supply relationship, the key to boosting milk production. At the heart of milk production lies a beautiful and intricate dance between supply and demand. Think of it like this. The more your baby nurses or you express milk, the more your body receives the signal to produce more. It's a remarkable feedback loop, responding to your baby's needs and ensuring a steady flow of nourishment. Imagine your breasts as a wellspring, constantly replenishing as water is drawn from it. The act of nursing or pumping acts as the draw, stimulating the release of hormones that trigger milk production. The more frequently and effectively milk is removed, the stronger the signal to your body to increase supply. This understanding empowers you to become an active participant in your breastfeeding journey. By nursing on demand, offering both breasts at each feeding, and ensuring your baby is latching correctly, you are essentially sending clear messages to your body to ramp up milk production. Section 3. Nourishing your body, nourishing your baby, the power of hydration and nutrition. Just as a car needs fuel to run smoothly, your body requires adequate nourishment to produce milk that is both abundant and nutrient-rich. Think of your diet as the building blocks for your breast milk, providing the essential vitamins, minerals, and calories your baby needs to thrive. Imagine a colorful plate filled with fruits, vegetables, whole grains, lean proteins, and healthy fats, a symphony of flavors and nutrients working together to support your milk supply. Staying hydrated is equally important, as water forms the base of your breast milk. Think of your water bottle as your constant companion during your breastfeeding journey. Aim for 8 to 10 glasses of water throughout the day, replenishing fluids lost during nursing sessions. Listen to your body's cues, and if you feel thirsty, reach for that water bottle. It's a simple yet powerful way to support your milk production. Section 4. Maximizing milk expression, effective pumping and hand expression techniques. Expressing milk through pumping or hand expression is a valuable tool. Build a freezer stash for when you're away from your baby, It can also help increase milk supply. Find a comfortable and effective technique. Experiment with different flange sizes. Explore various hand expression techniques. Apply a warm compress or take a warm shower. This can help stimulate milk flow. With practice, you'll find a rhythm that works for you. Section 5. Seeking professional support. When to consult a lactation expert. While the tips and strategies we've discussed can be incredibly empowering, it's important to remember that you don't have to navigate this journey alone. Lactation consultants are highly trained professionals specializing in breastfeeding support, and they can provide personalized guidance and reassurance every step of the way. Think of a lactation consultant as your breastfeeding cheerleader, armed with a wealth of knowledge and practical tips to help you overcome any challenges. If you're concerned about your milk supply, experiencing pain during nursing, or simply have questions or concerns, don't hesitate to reach out for professional support. Lactation consultants can assess your baby's latch, evaluate your breastfeeding technique, and provide tailored solutions to address any underlying issues that might be affecting your milk supply. They can also offer reassurance, encouragement, and a safe space to discuss your breastfeeding journey without judgment. Section 1. Understanding engorgement, a normal part of the breastfeeding journey. Engorgement happens when your breasts become overly full of milk, leading to feelings of fullness, tightness, and sometimes discomfort. It's a normal physiological response and a sign that your body is working hard to nourish your little one. In the early days, your body might produce more milk than your baby needs, leading to a temporary feeling of fullness. As your milk supply increases, your breasts might feel firm, warm to the touch, and even appear larger than usual. Section 2. The timing of engorgement, when to expect it and how long it lasts. Engorgement typically occurs within the first few days after birth as your body transitions from producing colostrum to mature breast milk. As your baby grows and their demand for milk increases, your body responds by increasing milk production, often leading to engorgement around day 3 to 5 postpartum. The good news is that engorgement is usually temporary, lasting for a day or two as your body adjusts to your baby's feeding patterns. If engorgement persists beyond a few days, or if you experience significant discomfort, seek guidance from a lactation consultant or healthcare provider. Section 3. Recognizing the signs. How to tell if your breasts are engorged. During engorgement, your breasts might feel full, tight, and tender to the touch. The skin around your nipples might appear stretched and shiny, and your areolas might become firmer and more pronounced. You might experience a throbbing sensation, a feeling of heaviness, or even a slight temperature increase in your breasts. These sensations are your body's way of signaling that your breasts are full and need to be drained. Section 4. Finding relief. Effective strategies for managing engorgement. Gentle breast massage can work wonders in relieving engorgement. Using your fingertips, make circular motions around your breasts, starting from the outer edges and moving towards your nipples. Applying a warm compress or taking a warm shower before breastfeeding can help soften the breast tissue and encourage milk letdown. This makes it easier for your baby to latch. Section 5. Preventing engorgement. Proactive tips for a more comfortable experience. One of the most effective ways to prevent engorgement is to breastfeed frequently and on demand. By nursing your baby whenever they show hunger cues, you're preventing your breasts from becoming overly full. Ensure your baby is latching correctly to prevent milk from building up in the breasts. If you're unsure about your baby's latch or experiencing pain during breastfeeding, seek guidance from a lactation consultant. Let's talk about clogged milk ducts, a common breastfeeding challenge that can arise when the flow of breast milk encounters a bit of a traffic jam. A clogged milk duct occurs when a milk duct becomes blocked or constricted, impeding the smooth flow of milk. This blockage can happen for a variety of reasons, often related to incomplete or infrequent milk removal. If a breast is not drained effectively or often enough, milk can start to accumulate in the ducts, creating a prime environment for a clog to form. This can happen if a baby is not latching well, if there's a change in feeding patterns, or if a mother is producing a large amount of milk. This blockage can lead to discomfort, tenderness, and even a small localized lump in the breast. Now that you understand what a clogged milk duct is, let's explore the signs and symptoms so you can recognize it and address it promptly. A clogged duct typically presents as localized tenderness in a specific area of the breast. You might also notice that the discomfort intensifies right before or during a feeding session, as the pressure builds within the milk duct. In some cases, a clogged duct might also lead to a slight decrease in milk output on the affected side. Once you've identified a clogged duct, the next step is to focus on strategies to gently and effectively unclog the flow of milk. Start by applying a warm compress to the affected area for 10 to 15 minutes before each feeding session. Use your fingertips to massage in a circular motion, moving towards the nipple. This gentle pressure can help dislodge the clog and encourage milk flow. Think of it like a gentle stream of water dislodging a small obstruction in a pipe. The power of prevention, keeping those ducts clear. One of the most effective preventative measures is frequent and effective milk removal. The more often you empty your breasts, either through breastfeeding or pumping, the less likely milk is to accumulate and clog the ducts. Frequent breastfeeding or pumping helps establish a regular flow of milk through the ducts, reducing the likelihood of blockages. Think of it like a well-worn path through a forest. The more frequently it's used, the clearer and more defined it becomes. Seeking expert guidance. When to consult a lactation consultant. Lactation consultants are highly trained professionals specializing in breastfeeding support, and they can provide personalized guidance and reassurance every step of the way. If you're experiencing persistent clogged ducts, despite trying home remedies, or if you notice signs of infection, such as fever, chills, or flu-like symptoms, seek professional help. Lactation consultants can assess your breastfeeding technique, evaluate your baby's latch, and provide tailored solutions to address the underlying causes of clogged ducts. They can also offer reassurance, encouragement, and a compassionate ear, creating a safe space for you to voice any concerns or anxieties you might have. Understanding milk letdown, the symphony of hormones and reflexes. Let's delve into the fascinating world of milk letdown, a beautifully orchestrated process involving hormones, reflexes, and a touch of motherly intuition. At the heart of this symphony is the hormone oxytocin, often referred to as the love hormone or the cuddle hormone. This powerful hormone, released in response to your baby's suckling or even just the thought of your baby, signals the muscles surrounding the milk-producing glands in your breast to contract and release milk. This release of milk is what we call the letdown reflex. Now that you understand the mechanics of milk letdown, let's explore the subtle and not so subtle signs that indicate your body is responding to your baby's cues and releasing milk. Recognizing these signs can reassure you that your body is working as it should and help you anticipate your baby's needs. Imagine a gentle tingling sensation in your breasts, sometimes accompanied by a feeling of fullness or warmth. You might also notice a change in your baby's sucking pattern. As the milk starts to flow, their sucks might become deeper and more rhythmic, often accompanied by audible swallowing sounds. While milk letdown is a natural reflex, there are times when it might feel elusive or delayed, leading to frustration for both mother and baby. One of the most common culprits behind delayed or inhibited letdown is stress. When you're stressed, your body releases adrenaline and cortisol, hormones that can interfere with the production and release of oxytocin. Other factors that can affect milk letdown include pain, fatigue, dehydration, certain medications, and even past breastfeeding experiences. For example, mothers who've had breast surgery or experienced trauma to the breast area might find that their letdown reflex is affected. Now that we've explored some of the challenges that can affect milk letdown, let's focus on practical tips and techniques to encourage a smoother and more consistent flow. One of the simplest yet most effective ways to encourage milk letdown is to create a calm and comfortable breastfeeding environment. Dim the lights, find a comfortable position, and minimize distractions. Before each feeding, try applying a warm compress to your breasts or taking a warm shower. This can help relax the muscles surrounding the milk ducts and encourage milk flow. Picture this. You've settled into a comfortable position, your little one is nestled in your arms, and as they begin to nurse, their eyelids start to flutter, their sucks become slower, and within minutes, they're sound asleep. It's a common scenario for many breastfeeding mothers, often met with a mix of amusement, tenderness, and a touch of concern. Is my baby getting enough to eat? Rest assured, babies falling asleep at the breast is a normal part of breastfeeding, especially in the early weeks and months. The warmth of your body, the rhythmic sound of your heartbeat, and the sweet taste of your milk create a sense of security and contentment that can easily lull them into a peaceful slumber. It's no wonder they often drift off to sleep, their tiny bodies and minds lulled into a state of blissful relaxation. While a sleepy nurser is often a content nurser, it's natural for mothers to wonder if their baby is getting enough milk when they doze off mid-feed. After all, you can't exactly ask your little one if they're full. The good news is that there are subtle signs and cues you can look for to gauge your baby's satisfaction and ensure they're thriving. One of the most reliable indicators of adequate milk transfer is your baby's diaper output. Think of it this way. What goes in must come out. In the early days, your baby's stools will transition from meconium, a sticky black substance, to softer yellowish stools as they begin to digest breast milk. As your milk supply increases and your baby becomes more efficient at nursing, you should notice a significant increase in the number of wet and dirty diapers. A general rule of thumb is 6 to 8 wet diapers and at least 3 to 4 bowel movements in a 24-hour period. While a sleepy nurser is usually not a cause for concern, there are times when you might want to encourage your little one to stay awake and finish their meal, especially if you're concerned about their weight gain or if they have a tendency to fall asleep quickly at the breast. Think of it this way. Just as you might gently rouse a loved one from a light slumber, there are gentle ways to re-engage your baby during a feeding session without disrupting the flow. One effective technique is to incorporate skin-to-skin contact. Imagine the warmth of your baby's skin against yours, a symphony of gentle touch and soothing warmth. Skin-to-skin contact not only strengthens the bond between you and your little one, but also helps regulate their temperature, heart rate, and breathing, creating an optimal environment for breastfeeding. While the tips and strategies we've discussed can be incredibly helpful in addressing sleepy nursing, it's important to remember that you don't have to navigate this journey alone. Lactation consultants are highly trained professionals specializing in breastfeeding support, and they can provide personalized guidance and reassurance every step of the way. Think of a lactation consultant as your breastfeeding cheerleader, armed with a wealth of knowledge and practical tips to address any concerns you might have. If you're worried about your baby's weight gain, if they're not showing adequate diaper output, or if you're simply feeling overwhelmed or uncertain, don't hesitate to reach out for professional help. Lactation consultants can assess your baby's latch, evaluate their milk transfer, and provide tailored solutions to address any underlying issues that might be contributing to their sleepiness at the breast. They can also offer reassurance, encouragement, and a safe space for you to voice any concerns or anxieties you might have, empowering you to breastfeed with confidence and joy. Let's talk about nipple confusion, a term that often sparks anxiety and uncertainty for breastfeeding mothers. Imagine this. You've been exclusively breastfeeding, and then you introduce a bottle. Your baby, once a champion nurser, now seems hesitant at the breast. This change might be a sign of nipple confusion. They're adapting to different sucking mechanisms for breastfeeding versus bottle feeding. Now that you understand what nipple confusion is, let's explore the signs that might indicate your little one is experiencing this common challenge. Recognizing these signs early on can help you address them promptly and get back to a happy and harmonious breastfeeding relationship. Imagine this. Your baby, once a pro at latching onto your breast, now seems to struggle to get a good grasp. They might bob their head, fuss, or pull away from the breast, as if they're not quite sure what to do. This change in latching behavior is often one of the first signs of nipple confusion. You might also notice a change in your baby's sucking pattern. Instead of the deep, rhythmic sucks they once had at the breast, their sucks might become shorter, shallower, or more erratic. They might even start to click or make a smacking sound while nursing, as if they're trying to recreate the faster flow of milk they experienced with a bottle. While nipple confusion can be a frustrating hurdle, the good news is that it's often preventable with a little planning and a focus on establishing a strong breastfeeding foundation in the early weeks. Think of it this way. Just as a sturdy foundation is essential for a well-built house, a solid breastfeeding relationship provides a strong base for introducing a bottle without disrupting the flow. One of the most effective ways to prevent nipple confusion is to delay the introduction of bottles until breastfeeding is well established, typically around 4 to 6 weeks postpartum. This gives your baby ample time to master the art of breastfeeding, developing a strong suck, a good latch, and a clear preference for the breast. During these early weeks, focus on creating a breastfeeding sanctuary, a calm, comfortable, and distraction-free environment where you and your baby can connect and nourish without interruption. Practice skin-to-skin contact, respond to your baby's hunger cues promptly, and offer the breast frequently, even if it's just for comfort sucking. If your little one is showing signs of nipple confusion, don't despair. Just as a skilled gardener can nurture a wilting plant back to health, you can reclaim the breastfeeding bond and restore harmony to your feeding routine. It might require a little patience, a touch of creativity, and a whole lot of love. But with persistence and the right strategies, you can overcome this challenge and continue your breastfeeding journey with confidence. One of the first steps is to prioritize breastfeeding as much as possible. Think of it this way. The more opportunities your baby has to practice breastfeeding, the more quickly they'll relearn the skills and regain their confidence at the breast. Offer the breast frequently, even if it's just for short periods, and be patient as your baby adjusts. Imagine a gentle dance, with each step bringing you closer to your goal. That's the kind of approach you want to take when addressing nipple confusion. Be patient, be persistent, and most importantly, be kind to yourself and your little one as you navigate this journey together. As we reach the end of this guide, acknowledge the incredible journey you've embarked on as a breastfeeding mother. It's a journey that requires patience, perseverance, and a deep well of love. From tender latches to moments of uncertainty, you've navigated breastfeeding with grace and resilience. Each challenge, whether sore nipples, engorgement, or milk supply concerns, has been an opportunity for growth. Remember those early days? You've come so far since then. You've become a breastfeeding expert in your own right, and that, mama, is something to celebrate. Just as every baby is unique, so is every breastfeeding journey. There's no one-size-fits-all approach, no magic formula that guarantees a smooth and effortless experience. Embrace the uniqueness of your journey, knowing that there will be ups and downs, twists and turns, and moments when you need to pause, adjust, and find a new rhythm. Remember that breastfeeding is a dance, a delicate interplay between you and your baby. Some days, the dance will flow effortlessly, with each movement in sync with the other. Other days, it might feel like you're both learning a new step, a little unsure, a little clumsy, but always moving forward together. Trust your instincts, listen to your body, and don't be afraid to seek support when you need it. Whether it's from a partner, a family member, a friend, a lactation consultant, or a healthcare provider, surround yourself with a circle of support that uplifts, encourages, and celebrates your breastfeeding journey, no matter what it looks like. As you continue on this incredible journey of motherhood, carry with you the knowledge that you are strong, capable, and deserving of all the support and encouragement you need. Breastfeeding, while natural, is not always easy. It's a skill that takes time, patience, and a whole lot of love to master. There will be moments when you feel overwhelmed, exhausted, or uncertain. There will be days when you question your choices, your body's ability, or your worthiness as a mother. During those times, remember this: you are not alone. Millions of mothers around the world have walked this path before you, and they stand with you now, offering their support, their wisdom, and their unwavering belief in your ability to nourish and nurture your little one. So, Mama, as you embark on this next chapter, know that you've got this. You are strong, you are capable, and you are doing an amazing job. Embrace the journey, celebrate the milestones, and never hesitate to reach out for a helping hand when you